inspired me today was seeing so many mayors passionate about the work that they do.
It's been a really great opportunity to, I guess, shine a spotlight on health and wellbeing in our communities. Our health and wellbeing plan is embedded across our council plan, but I think sometimes it's easy for those day-to-day initiatives to get lost, and I think just to apply that lens over what are we doing in our community to really support people in their wellbeing journey.
What really struck home to me is that we all have a role to play when it comes to helping people to be connected, involved, have purpose and have meaning in our community, and that some people are isolated and that they are suffering alone, and that we really need to help to support all in our community to be as connected as best as possible.
I've really been inspired by hearing from the other mayors and deputy mayors in the room. I think there's so much to be gained from sharing the information, sharing the different activities and policies that our councils have. I think that's really valuable, and there's a lot that I'll take back to my councillor group.
I really enjoyed Rob Moody's presentation where he was talking about leadership and the importance, particularly when you've got diverse groups.
Truly incredible to see how passionate all these individuals are from the municipalities, representing their communities and their people, and really speaking up for important matters.
Hearing other councils' opinions and ideas around community health and wellbeing and the varying ideas, what it means to everybody. So for some people it's about young people involvement, like youth involvement. For other people it's about the older generation involvement, but and all the spectres in between. So yeah, that was really inspiring to hear different opinions and different attitudes towards community health and wellbeing.
Yes, I'm proud to support our actual community health and wellbeing with all the programs and free events that we do. I'm really, really proud of all our free events because it brings neighbourhoods, like ours will be a film in a park, and we have face painting and bubbles and sausages and coffee, and families come and then they sit next to other families and get to know their community, and they're just growing, and we do 3 every year. Plus we do a dog's day out and fun runs, Christmas carols, Maroondah Festival. It's just so many things out there that I'm proud of what we do and just want to keep promoting them.
One thing that I'm extremely proud about that we're doing in the city of Maribyrnong is we've created a homelessness response network that brings together our service providers to have conversations, collaborate and plan forward in how we'll service and create a wraparound support system for our rough sleepers and those experiencing acute mental health issues.
South Coast Shire just recently did a Healthy, Wealthy and Wise workshop or roadshow in Anglesea. That went really well. Lots of older people finding out what sort of things they can join in. It was a superb initiative.
Well, it was interesting for me. It's normal, but when I mentioned it today around the idea that our Shire runs free swim Fridays, which means for our 6 outdoor pools, the community is able to access those on a free every Friday during summer. Like I said, that's normal for me, but for the group in the room, it was groundbreaking, and I've had a number of questions afterwards about that, how we run it, what data we collect, so perhaps there's other shires that are looking to follow in our footsteps.
That I'm personally involved in, which is the Albury-Wodonga Regional Health Alliance, which is a group of 12 councils advocating for a new hospital or new site, supported by some community advocacy groups as well. It's a great initiative with very, very strong community support.
We need to see more investment in community infrastructure.
We need more active transport within our communities and also connecting our communities.
One bold change that's needed in my community is some actual mental health services. Saying now that mental health in rural communities is more than a media release, that we actually need on the ground support.
I think there was a lot of talk around community connection, how to encourage inclusivity and to make especially our young people more connected. I don't have the answer to it yet, but that is definitely something that I would love to work on.
I think just getting, obviously we've already got the Maribyrnong Youth Advisory Committee, and we've got a lot of young people able to advocate for themselves and their communities, but really pushing for young people to speak up, you know, to get them to talk directly to counsellors, even though it's pretty scary. Young people have so much to say, so facilitating an environment where they can talk, that's the bold change I would like to see next.
Advocate for community sport, and particularly at the moment, participation levels in community sport have dropped because of the cost of living. So if there was one thing, a magic wand that I could bring, it would be to reduce the cost of living. It would be for state and federal governments to pull the levers that they can pull to reduce the cost of living, and also to get better investment from state and federal government in our community facilities that would enable better participation in community sport, because as somebody who participated in community sport when I was much younger, I can tell you it's great for mental health and well-being of our community. So it's a great thing to grow up around other people, to learn discipline, to learn to live in a community and have other people around you that care about you all the time. So yeah, if we could change that, let's change that.
And it's the first time I've been to the MAV offices and I've loved it.